The SamSling. The intended users of the SamSling include emergency medical services, hospital emergency departments, search and rescue personnel, wilderness and remote medical providers, military. The SamSling is the first and only force-controlled circumferential pelvic belt designed to provide safe and effective reduction and stabilization of pelvic fractures. Pelvic ring fractures are among the most serious of all musculoskeletal injuries. The mortality rate for complex pelvic ring fractures is reported to be 25% or higher. This mortality rate increases in the elderly and in the presence of shock. Physical examination is often inaccurate. Average blood loss can be as high as 2 to 3 units per break. Early control of life-threatening hemorrhage is the primary goal in the emergency management of pelvic ring fractures. The application of circumferential compression with a pelvic belt can significantly reduce and stabilize pelvic ring fractures, decrease hemorrhage, and lessen the need for pain-relieving narcotics. The SamSling is a lightweight, durable, and effective force-controlled circumferential pelvic belt. The SamSling is available in 3 sizes: small, medium, and large. It is the only pelvic belt or binder to feature a patented buckle designed to engage when the correct, safe amount of constrictive force is applied. This buckle provides an added measure of safety when the sling is applied on scene by all levels of trained EMS personnel. The anterior section of the sling is sufficiently narrow to allow for examination, catheterization, and access to the femoral vessels. Anterior external fixation can be applied without removing the sling. Also, the belt portion may be trimmed in certain areas if access is limited. The sling is padded for comfort. A plastic slider on the back of the sling decreases friction on backboards. The sling is radiolucent, except for 2 small coils. Warning: do not use the SamSling in an MRI scanner. Before using the SamSling, you must read and practice the instructions for use. These instructions are printed in several languages on every package. When you unfold the SamSling, you will see that it is composed of 2 parts. The first part is a soft padded belt, which is white on the inner patient contact surface and blue on the outer surface. On the back of the belt is a plastic slider. It is designed to allow the belt to easily slide along the surface of a backboard. A bright orange loop of strong fabric is sewn to one end of the belt. The largest portion of this loop forms a fixed pull handle. Attached to the opposite end of the same loop, extending just beyond the end of the belt, is an orange plastic buckle. This unique patented buckle is designed to engage when the correct constrictive force is applied to the belt. The second part of the SamSling consists of a sturdy padded flap. The same blue fabric as the belt covers one side of the flap. The opposite side of the flap consists of Velcro-type hooks, designed to firmly adhere to the blue fabric of the belt. Attached to the flap is a strip of perforated black webbing with an orange loop handle on the end. This handle is referred to as the free pull handle. One surface of this loop handle contains Velcro-type hooks designed to strongly adhere to the blue fabric covering the pad and outer surface of the belt. When the sling is removed from its package, the padded flap is attached to the plastic buckle by a loop of webbing. The loop is secured to the padded flap by the Velcro-type hooks on the free pull handle. Beneath the padded flap is a small safety slip indicating the buckle on the sling has been tested and proven to provide the correct compression force. The general application technique. Before applying the pelvic sling, check the patient's clothing, belt, and pockets for any hard objects, such as a cell phone or keys. You may want to remove a large belt buckle. Also, be sure to remove any glass, rocks, or debris from the patient. Next, locate the bony prominences on the side of the hips, called the greater trochanters. These prominences are generally at the same level of the symphysis pubis and buttocks. This is the correct level for sling application. After you have located the greater trochanters, place the white side of the belt around the patient's body, generally positioning the buckle in the midline. Next, firmly wrap the padded flap and webbing around the body to ensure a snug fit. Secure the sling to the patient by pressing the Velcro-type surface of the padded flap against the blue belt. Once the sling is secured to the body, hold the padded flap in place and lift the free pull handle away from the flap. Then grasp the fixed pull handle on the other side of the belt and pull the two handles in opposite directions. Keep pulling until you feel or hear the buckle click or stop. When you determine the buckle has engaged, do not release tension. Maintain tension and firmly press the free pull handle against the belt. The Velcro-type hooks on the surface of the free pull handle will secure it in position. Do not be concerned if you hear a second click sound after the sling is secured. To release the pelvic belt, lift the free pull handle away from the belt and slowly release tension. Again, here are the key application points. Always apply the SamSling at the level of the greater trochanters. This is typically at the level of the buttocks or symphysis pubis. Do not apply around the waist. When tightening the belt, pull on the handles until you hear or feel the buckle click or stop. At that point, do not release tension on the free pull handle. Maintain tension until you press down on the Velcro-type surface of the free pull handle to engage the belt. SamSling application on a patient in the supine position. The patient may or may not be on a backboard. Before applying the sling, check the patient's belt and pockets for any hard objects, such as a cell phone or keys. You may even want to remove a large belt buckle. Also, be